Hello and welcome. My name is Sean Gallagher and I am here to just explain a few points about the SImpson protocol process for preparing for childbirth. Just a little bit about myself. I used to be a midwife and I have been teaching prenatal classes for a very long time, since about 1986. And I have been teaching regular hypnosis classes for childbirth preparation since '99, and when I found out that Inez was working with this particular protocol that she created I was very excited, because I believe it takes hypnosis preparation for birth to the next level. So I just wanted to cover a few points on all of this. And you may have more questions as well, and I would encourage you to contact your hypnotist to have specific questions answered. The idea around this particular process is that it allows for a very profound level of comfort, and with anything, when we're masking pain or discomfort, we want to make sure that that's done safely, and it's very important that the medical safeguards are handled properly for childbirth, and that is covered in this program. So the most important thing is your safety and well-being, and the safety and well-being of your baby, and we've managed to ensure that that's incorporated in a quite significant way in this particular program. The other important thing in all of this is that not every physician and midwife attending births really perhaps understands how powerful a program like this can be. And from what I've seen with the work I've done and what's available, out there, is that the SImpson protocol is actually a much more powerful program than just regular hypnosis. So it's very important that your care provider have at least a basic understanding of what to expect. And it may well be that your care provider is thinking that, yeah, you will be relaxed in the birth and things will go well, but the ability to perhaps be in very strong active labor and not appear to be in active labor is what will be happening for you in the birth. So your hypnotist will be providing a letter to your midwife or your physician to ensure that all of these important pieces are covered. The other process to understand is that these births are often quite fast, so that it's important that if you're contacting your care provider, if you're having a home birth, your midwife will be coming to you. If you're planning a hospital birth, you'll be leaving for the hospital, that the process in all of this, that fast births are a possibility, definitely, and just so that your care provider will be understanding this process. This ability to prepare for birth is for any type of birth. So certainly there are some times where medical interventions are necessary. You can definitely incorporate the SImpson protocol for that. Generally speaking, most women are preparing for natural childbirth, and that's generally kind of what we're focusing on, but you can adapt this. The thing that makes this, I would say, the most powerful program that's available in the market is that you're going to be working not only with your unconscious mind, but you will be working with your superconscious mind. And your superconscious mind is that higher mind that's a very wise mind that understands everything. For the most part, the unconscious mind is a very good mind. It tends to be quite literal. It tends to be more of a mind that is able to take orders and ensure that they're carried out in an appropriate way. The superconscious mind really understands in a profound way exactly how, say, the middle section of your body can be completely comfortable. You'll be able to walk, you'll be able to move around, you'll be able to be comfortable throughout this process while birthing your baby. And to a large extent, science still doesn't understand how that is possible in terms of just the biochemistry and exactly what's going on physiologically in the body. And we may never know what that is, but your superconscious mind does, and your superconscious mind will be that more important mind that will oversee this entire process. With this process, you will be doing homework, and the homework is not extensive. It can be quite quick, and it can be 5 or 10 minutes a day. Because it feels really, really good to go into these deeper states, a lot of people will just want to stay in this deeper state for a longer period, and that's up to you. But you will want to be able to be quite competent and adept at taking yourself into very deep, profound states, as well as being able to bring yourself out and just get quite comfortable and confident with all of that. One of the exciting aspects to all of this, from my perspective, is there are some wonderful side effects that come along with this that are part of that process of a greater level of bonding that happens typically with your baby. We know that you want the safest birth possible for your baby, and a natural birth with your body's own natural anesthetic is the best way to go in that regard, because your own natural anesthetic that your body makes is good for you and it's good for your baby. We know that childbirth is changing these days, and it is different than it was even, say, 20 years ago. The cesarean section rates are climbing, and most hospitals have very high epidural rates, usually around 90–95%. And it can be quite difficult to walk into a setting that is established in a way that is only set up for a particular kind of way. The easiest way to manage that is to shift your internal state, and having this relationship with your baby that starts before your birth is deeply profound, and it allows not only your body to understand the process for fast, easy, calm, comfortable birth, but your baby is actually listening to all of this that's going on. Your baby's sense of hearing is the first to develop in utero, and so your baby is hearing all of this. And as your baby understands how it can be just really easy to get born, and birth can be a lovely experience, and that the days, weeks, and months to follow are going to be just really quite wonderful, because as you and your baby connect, it's just a deeper, more profound state. The research, certainly in my experience with my clients, definitely shows that mood disorders are significantly reduced postpartum, and that ability to just fall in love with your baby more and more each day, to have a greater connection, is really, I would say, one of the greatest gifts you can give your baby in terms of a lifetime of excellent health, physically, emotionally, on all of the levels, that will just be hugely helpful and beneficial for you, your family, and your baby overall. And so that's why this particular program with the SImpson protocol has all of this incorporated within it. So it's all part of the sessions that you will be receiving, and you will be working with your baby in all of this. And we've gone to a fair bit of attention to ensure that all of this is incorporated within your program. You will be doing the appointments with your hypnotist in a rather kind of structured way, and your hypnotist knows what that is, and we'll be covering some certain key points, and we will discuss what those points are. But for the moment, just to know that your safety, your well-being, your safety and well-being of your baby is the most important thing, and you will be really enjoying a quite wonderful birth. Thank you very much for taking this time to review this piece.